Some of the solutions are really right in front of us. There are practical steps that we can take now that will give people the choices and the tools that they need to take more control over their long-term care and also save the public money. President Bush laid out his vision for long-term care in his New Freedom Initiative. Under this initiative, the President called for a system of care that empowers people to make informed decisions and places more emphasis on care that they can receive in their own homes and within their communities where they want to be. Under his leadership and with the help of Congress, we have doubled the funding for home and community-based care under Medicaid and have held the growth in nursing home spending to over 3%, just over 3% annually, not much more than the inflation in general and well below the medical inflation. We have invested almost $300 million in grants to states to help them change their systems of care to make them more cost-effective and more responsive to consumer needs. We have also provided over $40 million to help 43 states, including the state of Ohio, to set up what we call one-stop shop, entry points to long-term care services and supports. These one-stop shops serve as a visible and trusted source that people can turn to for objective information on all their options, alongside with one-on-one personalized assistance in understanding and accessing their care. We have partnered with governors and states on public education campaigns known as the Own Your Own Future campaign to make people more aware of the importance of planning ahead and steps they can take that will give them more control over their long-term care. Just last week, I joined Governor Strickland to launch the Ohio Own Your Own Future campaign, which will reach nearly 2 million households in this state between the ages of 45 and 65. We're also expanding the opportunity for states to develop incentives for consumers to buy long-term care insurance through the Long-Term Care Partnership Program. And we have also worked with states to implement low-cost, evidence-based prevention programs that are helping seniors in over 350 regional communities to reduce the risk of disease and disability and improve their physical and mental health. We're also helping seniors to take advantage of the new prevention benefits under Medicare that can screen for many diseases and conditions that, if caught early, can reduce or prevent serious and costly complications. We have also authorized or reauthorized the Older Americans Act, the program that I administer, to strengthen its role in community-based long-term care. The Older Americans Act is one of our nation's best-kept secrets. As you see, the Older Americans Act was created simultaneously with Medicare and Medicaid in 1965. The Act supports a nationwide network of over 29,000 public and private sector organizations that reach into every community in this country, providing low-cost social service and important home supports to over 9 million seniors and almost 1 million family caregivers each year. Known as the Aging Services Network, this network played a central role in helping our seniors learn about and enroll in the new Medicare prescription benefit that came online 2 years ago. It's an existing infrastructure that our federal, state, and local communities can readily utilize to reform long-term care. One of its greatest assets is its ability to reach people before they enter a nursing home and spend down to Medicaid. Here in Cleveland, you can access the Older American Act network of services through the Western Reserve Area Agency on Aging. Ron Hill is out there in the audience, and its many partners throughout the city, such as the Ohio Department of Aging for the state, the Benjamin Rose Institute, which is working with the Administration on Aging to help the network implement the new improvements to the Act, and dozens of other community providers. Without these community-based organizations, many of our older neighbors, relatives, and friends would not be able to remain living independently in their homes. I believe long-term care is the biggest challenge of our time. and we, the government, cannot do this alone. I believe the initiatives that we have launched to rebalance our system and make it more consumer-centered provide a solid foundation for reform and go to really the heart of what we need to do as a nation to achieve a successful long-term care system. But there's a sense of urgency here. We need to accelerate the pace at which we are advancing these changes and bringing them up to scale nationwide. When properly and fully executed, these initiatives can help our citizens get the care they need and want in the community, and may, in fact, actually reduce the rate of growth in Medicaid and Medicare. This can be a real pay-as-you-go approach to building the future of long-term care. It is time that we get serious about this issue. It is our responsibility as taxpayers to get it right. Here are some of the things that I think we need to accomplish. Every American, young and old, must begin to take greater personal responsibility for their old age and retirement. This includes not only saving for future health care costs and retirement costs, but also making responsible, conscious decisions about how they will address and finance their long-term care needs for their own good and the good of our country. We need to build the goods and services that Americans will need as the nation ages, including better value in health care. We need to make it easier for our citizens to learn about their options and make informed decisions about their care. We also need to give people who depend on public programs and are at the highest risk and the poorest conditions more control over the types of services they receive and the manner in which they receive them. We need to support our first responders, America's heroic family caregivers, our most important partners in caring for our aging population. And we need to make prevention, yes, prevention, a central part of long-term care, not just health care. We can do this by using the best available science to empower people to make small behavioral changes that can significantly improve their health through better exercise and nutrition, falls prevention programs, and training that can help people better self-manage their chronic conditions, such as arthritis and diabetes. Falls alone, and the risk of falling, actually take about $20 to $30 billion out of our health economy each year, and are the leading cause of injury and death among older people. We should be redirecting some of these dollars into preventing falls from happening in the first place. As I said when I began, the time to act is now. We have a serious challenge ahead of us, and there's no time to waste. We have a significant opportunity to advance the values and principles of a balanced long-term care system for older Americans and their families. Over the last decades, we have literally added years to our lives. Now we must add quality to those years. We need to grapple with the issues of the legacy we wish to leave for our children and for our future generations. And each and every one of us, here and throughout this country, has a stake in this. This is truly a self-interest issue, you know. Self-interest that is rightly understood. We need to make tough decisions about the priorities for a graying nation, not just today, but for all those who will come behind us tomorrow. I believe we need to organize a new American agenda, one in which Americans of all ages have a voice in their future and in how they will care for their loved ones and themselves as they age. We need to create a system of care in which we would all want to grow old in, one that will allow each and every one of us to live out our lives with dignity and independence. So the time to act is now. Thank you very much.